Hello and welcome to COVID Conversations. I'm your host, Kimberly Pierce Cartwright, News and Public Affairs Director at WNCU 90.7 FM. And we're using this platform to talk about how COVID-19 is affecting our world. And I have the very wonderful pleasure today of having as my guest Dr. Malika of the Association of American Medical Colleges. And we'll talk about their new COVID-19 reset roadmap and how it aims to help Black communities in the United States. Dr. Fair is AAMC Senior Director of Health Equity Partnerships and Programs. Hello, Dr. Fair.
Hello, great to be here.
Oh, great to have you. What are you doing these days? I know that you were working actively in hospital, so COVID-19 has placed you where?
So I'm at home working from home most days, and I have the pleasure of being home with my 9-month-old infant. So she brings much joy in these challenging times.
Very good. Can you tell me a little bit about AAMC? What is that organization?
Sure. So the Association of American Medical Colleges is a not-for-profit organization that represents all the medical schools and teaching hospitals in the nation, as well as the medical schools in Canada and medical societies across the country. And our goal is to improve the health of everyone everywhere. And we do that by supporting our faculty, our students, and our learners across the country in their efforts to take care of patients, to produce research, and also to educate the next generation of physicians.
A little bit more about yourself and how you became a part of the association.
So it was a pleasure to join the AAMC about 8 years ago. I'm an emergency physician. I trained in the traditional route, but I was really interested in health disparities and interested in how we make sure that physicians across the country not only learn how to take care of the patient in front of them, but also take care of communities and better engage with communities. And at the Association of American Medical Colleges, my role is to support those learners, the faculty, in the efforts to modify the curriculum to include health equity, health disparities, social determinants of health, those buzzwords that you hear, but it's really important for our students to learn that. And I also help with how our hospitals can better engage with local communities.
So first of all, let's talk a little bit about your roadmap, the reset roadmap. What is that?
So that is a document that we put together to start a really important conversation. We noticed that there was a lot of misinformation out there about the pandemic and what that really meant for our nation. And with misinformation comes confusion, comes a lot of frustration. And so we decided to put together what the latest evidence was to stop this pandemic. And you'll see that there are 9 immediate actions that we're calling on our nation collectively to do, and 10 more long-term actions.
I want you to talk about African-American communities and the severity that the community is affected by COVID-19, and then talk about what the reset roadmap will do to incorporate their well-being.
So what we noticed this spring was that there were significant health disparities or worsening outcomes in Black and Brown communities. Specifically, Black and Latinx populations were 3 times more likely to be infected, 2 times more likely to die, which was just unacceptable. But this wasn't new. We've seen these health inequities in a host of other diseases, but this shone a light on that and also gave us an opportunity to act. So what the roadmap does is gives our country several actions that we can do, and some of which specifically speak towards health inequities. We know that African Americans sometimes, or a lot of us, have lost our jobs during this pandemic, and the roadmap calls for expanded health insurance, and for those who've lost their jobs to be able to stay on COBRA and to have COBRA supported. It also refers to vaccinations. A recent study showed that Black people are less likely to accept the vaccine when it's available. And that's concerning because we know that it's important that all of us take the vaccine so that we can, as a community, prevent the spread of this disease. And a lot of that comes from mistrust in our community. There have been egregious actions of the medical community towards Black people, and so that mistrust is real, and we have to do something about it and make sure that we can build that trust and make sure the vaccine is accessible to all. And finally, it also talks about testing in there. And in the roadmap, we call for an increase in the availability and accessibility of testing. We see a lot of shortages that prevent that. But one thing that we also want to mention is that we've seen their disparate access to testing in Black communities. So some areas, there are testing sites open, but they don't have the supplies that we see in white communities. Low-income communities tend to have less testing sites than affluent communities. And so we want to make sure we have an equitable approach to testing and that everyone has access in this nation.
Can you talk about now, like, and I know we've heard it like so many times over, but simple steps that everyone could take to prevent the spread of COVID-19?
Absolutely. So that's one of the elements of the roadmap as well, is to make sure we have consensus on mask guidelines. And as a supplement, we release very specific guidelines around wearing our mask and a list of do's and don'ts. Because you can see people wearing their mask under their chin or reusing their mask multiple times and things that are actually not helpful. And so in our mask guidelines, we've encouraged everyone to wear their mask every time they're leaving the house or every time they're around someone who's not in their household, that it's tight fitting around the nose and around the chin without any gaps, that it has at least 2 layers, preferably even 3 layers, so that you can prevent the spread of the virus. And when you breathe, that there are layers that can block that spread. And that you wash your mask regularly and do not share it with others. We hope that if we all follow these guidelines, in addition to social distancing or staying at least 6 feet apart, washing our hands regularly, that we can control the spread of this virus.
So you talked about masks. Is one mask type better than another? I see people when I'm out and about with different kinds of masks, from homemade to masks that look like they've come out of Star Trek.
There are several very fashionable masks out there, but I think the most important are the number of layers that are there and how you're wearing it. So if you only have a single bandana or if you only have a single layer of cloth, that's not going to be as effective as a 3-layer mask. Those paper surgical masks are just fine. But the ones that look like a scarf that you wear around your neck and it goes all the way up to your nose, those are not effective. Those are only a single layer, even though we see several people wearing those.
All right, there's so many people involved in this formula: the general public, state officials, local officials, public health experts, and businesses. How is the reset involve those people, and what's the way forward with all of these entities involved to combat the virus?
So this roadmap starts a conversation. It collects the evidence that we know right now, and it brings every sector together to start to have this conversation about what we need to do to come together. I think our partners in public health and law enforcement and on the federal government, this is something that we can use as a guiding document to further those conversations. But I think what's beautiful about the document is that you don't have to be a policy leader, you don't have to be a mayor, you don't have to be a physician. You can be, just a resident in any community and pick that roadmap up, and something can apply to you to help spread this virus.
So then you mentioned a little bit earlier about 9 actions that the AAMC believes are essential to long-term fighting the virus. So could you really quickly go through those 9 elements?
Absolutely. So the first is around drug shortages. And so we've noticed that across the country, there are shortages in laboratory supplies, in medications, and other supplies. And we call specifically on the federal government to negotiate in a way that we can alleviate these shortages, because it doesn't have to happen in our country. We've also noticed that, again, with the increased availability of testing that I already mentioned, and the face coverings that I already mentioned is number 3. The fourth is stay-at-home orders. You notice that maybe some cities will have a stay-at-home order where the neighboring city does not. The guidelines around when can you meet in groups of 10 versus 50, when is an essential time that you can leave your house, when do you have to stay inside your house. There's a lot of confusion around that, and we call on the nation to have established stay-at-home guidelines that is consistent across the country, that is easy to understand, and doesn't change city by city. We also know that there's a lot of discussion on school openings, and the National Academy of Science, Engineering, and Medicine came out with a document that gives a lot of information about what should be considered when opening specifically our K through 12 schools. And so we call on the country to get policy leaders together, educators, and all the relevant stakeholders together to test some of those ideas and see what's the best evidence. Because we know we want our children to be safe, we want the teachers to be safe. We also want our children to be socialized, and we don't want the digital divide. Several students don't have access to high-speed internet at home. So how do we think about all of those different factors? It's not going to be an easy fix, but we have to come up with a standard protocol in terms of opening our schools. Number 6 is expanding COBRA that I mentioned, because so many people have lost their health insurance and because they've lost their job. And we hope that the nation can support those who've lost their health insurance, and because COBRA is quite expensive. The 7th is vaccine distribution, which I mentioned, which really has to be in partnership with local communities because there's so much mistrust around taking the vaccine. Number 8 is addressing and resolving health inequities, which we've known all along, but of course it's in our face with this pandemic, and we need a multifaceted response to do so. And number 9 is about informing and educating and engaging the public. You can get information on any media outlet. You can get information from your physician and your public health department and from the White House and CDC. But unfortunately, there's a lot of conflicting information. And so we call on our nation to come together so that we can have consistent information. And we as physicians and our academic medical centers are ready to help provide that information in partnership with our state and local health departments.
So who are you making the presentation of this roadmap to? Is it like people who are working in government, local government, schools? Who is getting this information?
So this information is going everywhere. Absolutely to our partners on our colleagues on the Hill. We're making sure that our legislators hear this information to start this conversation so we can all get on the same page. But this is not limited to those individuals, because we hope that our mayors, our community leaders locally, our faith leaders, and that we can all use this roadmap as a guiding document so that we can turn this ship around.
Okay, I have a final question, and it has to do with like the entirety of the country. I know that you're looking at the data every day, but how are we doing as a country at this moment to control the virus?
Unfortunately, it's still not looking great. And we're concerned about what happens this fall as we go into flu season, and we have not turned this pandemic around. But I'm not giving up hope. I'm still very optimistic. And the reason why I'm optimistic is because of people like you, people in my community. I know that we can pull together. We do at this time, because it's so frustrating and so depressing sometimes, we do need to rely on our communities, our families, our faith to get through this. And we have to follow the guidelines around wearing our masks, social distancing, and washing our hands regularly.
Well, our time is done, Dr. Fair. Thank you for your time and this timely information that you've offered to us today.
Thank you for having me on your show.
My good pleasure. And thank you, audience, for watching and listening. Until next time, I'm Kimberly Pierce Cartwright, News and Public Affairs Director here at WNCU 90.7 FM.